Welcome to Week 2 of the DPS USRN NCELX Success Track. Our focus today is on delegation and assignment, a key part of the safe and effective care environment. In nursing practice, effective delegation is not about doing less, it's about ensuring safety, teamwork, and accountability. By the end of this session, you'll see how professional judgment, clear communication, and ethical leadership come together to keep patients safe. This week, we have 4 main goals. First, you'll learn to define delegation and differentiate it from assignment. Delegation means transferring a specific task to someone else, while still maintaining accountability for the outcome. Second, we'll apply the 5 rights of delegation, a framework that keeps delegation safe and structured. Third, you'll identify which tasks are appropriate for LVNs, licensed vocational nurses, and UAPs, unlicensed assistive personnel. Knowing who can do what is critical to patient safety. Finally, you'll understand the RN's role in supervision and accountability. No matter who performs the task, the RN remains responsible for the final patient outcome. Let's clarify 2 key concepts: delegation and assignment. Delegation is when the RN transfers a task, not the responsibility, to another qualified individual. For example, an RN may delegate vital sign measurement to a UAP, but still interprets the results. Assignment, on the other hand, involves distributing patient care among licensed nurses. A charge nurse may assign 3 patients to an LVN based on workload and scope. In short, delegation is about tasks. Assignment is about patient distribution. Every safe delegation follows the 5 rights. 1 right: task only delegate appropriate tasks, for example, assisting with feeding a stable patient. Never delegate IV push medications or initial assessments. 2 right: circumstance make sure the patient is stable and the environment is safe before delegating. 3 right: person match the task with the delegatee's competence and role, RN, LVN, or UAP. 4 right: direction or communication give clear, specific, and time-bound instructions. Clarify exactly what needs to be reported back. 5 right: supervision and evaluation always follow up, supervise as needed, and evaluate outcomes. These 5 rights form the foundation of safe, effective teamwork. Now let's review who can do what. RNs handle assessment, clinical judgment, education, IV medications, and unstable patients. They are the decision makers and advocates for patient safety. LVNs or LPNs manage stable patients, give oral medications, perform wound care, and reinforce teaching. They work under the RN's supervision. UAPs provide basic care such as hygiene, feeding stable patients, recording intake and output, and measuring vital signs. If a patient's condition changes, delegation must stop. The RN reassesses immediately. When you face multiple tasks, use a structured framework to decide. 1. Assess the situation and determine who is stable or unstable. 2. Apply ABC's airway, breathing, circulation, and Maslow's hierarchy to prioritize needs. 3. Match each task with the team member's scope. 4. Communicate instructions clearly and verify understanding. 5. Supervise and evaluate the results. If there's ever uncertainty, the RN must assess first. Remember, assessment and education cannot be delegated. Here are some examples you'll often see in practice and on the NCELX. UAP measure urine output, assist with ambulation, and provide hygiene care. LVN administer oral antibiotics, monitor stable patients, reinforce teaching already provided by the RN. RN only perform initial assessments, give IV push medications, provide patient education, and evaluate outcomes. These examples test your ability to match scope of practice to the task while keeping patient safety as your top priority. Let's look at a quick case. A patient with pneumonia needs IV antibiotics, vital signs, and hygiene care. Here's how we delegate. The RN assesses lung sounds and monitors the patient's response to IV therapy. The LVN administers the IV antibiotics per hospital policy and reports changes. The UAP assists with bathing, oral care, and records intake and output. Every member plays a part, but the RN supervises and stays accountable for the outcome. Here's an easy way to visualize the process. 1. Assess the patient's condition. 2. Is the patient stable? 3. Is the task appropriate to delegate? 4. Match the task with the right person. 5. Give clear directions and expected outcomes. 6. Supervise, evaluate, and document. You can delegate the task but never the accountability. The RN is always responsible for the overall patient care result. Watch out for these common NCELX traps. Don't delegate assessment, teaching, or evaluation. Don't delegate unstable patients or critical tasks like IV pushes. Do delegate stable, routine tasks such as feeding, hygiene, ambulation, vital signs, or recording I&O. Delegation questions often test your ability to choose the safest, most appropriate person for each task. Always think, is this safe for the patient? Is this within their scope? Question which task can be delegated to a UAP. A. Assessing response to diuretics. B. Teaching incentive spirometer use. C. Feeding a stable post-stroke patient on thickened liquids. D. Adjusting oxygen flow rate. Rationale. Feeding a stable patient is within a UAP's role. Assessment and teaching require RN judgment. Question which assignment is most appropriate for an LVN. A. New onset chest pain patient. B. Post-op day 2 stable cholecystectomy patient. C. Unstable GI bleed requiring titrated drips. D. Newly admitted DKA patient. Rationale. LVNs can care for stable, predictable patients with routine needs. RNs handle unstable or high-risk cases. To summarize, follow the 5 rights of delegation. They guide every decision. Match the task to the right person and communicate clearly. Remember, you can delegate the task, but not the accountability. The RN must always supervise and evaluate outcomes. And above all, patient safety always comes first. Delegation is a hallmark of leadership and teamwork in nursing. By delegating safely, you empower your team and protect your patients.